Hang on, where is Kate going now?
Good day, welcome. This is a gathering on Vyclone to think about some of the issues that paramedics face in real life. So we're interested in minors' consent. Are there any issues that keep you awake at night? My name's Kate Diesfeld. This is Hugo.
Hello.
Amanda Augustin.
And I'm Stuart.
Good. Stuart, can you tell us what you think about when you think about minors' consent?
So probably the biggest thing with minors' consent is at what stage do they have the right to say, I don't want a treatment, and to actually not get involved, because sometimes you do have the little kid who says, hey, I don't want you to stick a needle in me, yet the mother is saying, yes, stick a needle in me, or the kid's saying, yes, you can stick a needle in me, but the mum's saying, no, you can't. So at what stage does that override that, or the ethical dilemma in there? You know that you're doing something that's good. At what stage?
What about you, Hugo?
And I think there's a reasonable amount of ambiguity in the New Zealand law at the moment, because I believe it's very subjective. The debate around what constitutes a competent patient versus a non-competent patient. For example, if there's a 5-year-old, I think that the test is if you feel that they understand what you're saying and understand the implications, whether that's to treat or not to treat, then technically they can be deemed as competent. But their cognitive powers is up to your subjective interpretation of are they or not. So I think that's the ambiguity. I think needs to be cleared up by the legal experts to give us a lot more clarity around treatment in what can be quite difficult situations.
50 seconds. And I think also it's important to understand when a child becomes an adult, i.e. at what age can you say, right, mum and dad, you need to leave the room while I have a discussion with your daughter, your son, about their medical treatment or their medical journey.
So perhaps this sort of education, from maybe more legal advice, but also maybe education for parents, because maybe parents maybe feel that they have more rights than possibly they do.
Yes, and I think a lot of it stems back to having an education and a solid understanding of the legal implications of treatment and what you are entitled to or not do as part of your job. And I think if you were to canvass opinions across the service with existing ambulance staff, you'd probably get a difference of